Yes. So in the last 2 years, for example, we've seen about 820 patients new to Duke each year with brain tumors, which would make us the largest center in the world. And of that 820 or so, probably 500 to 600 have glioblastoma or GBM.
I mean, what's the ratio of survival with most people who are diagnosed with glioblastoma?
Well, the first thing is if you walk into our office complex or see our letterhead, it says at Duke there is hope. So we have a much more positive approach to that. There's probably 13,000 patients diagnosed each year. The median survival overall is quoted as about 14 months, which means half the patients die within 14 months or at 14 months. But in reality, there's an ever-increasing minority of patients who appear to be surviving and beating this disease. It's a minority. I'm not going to overstate it. But there are patients who do seem to win. So not long ago, I got a call, as I do every year, from somebody who's 18 years out, calls me every day, every year on the anniversary of her diagnosis and is thriving. We've got patients out 10, 15 years. There are winners. I can't tell you it's because of anything that any one medical advance has accomplished. It may be they just happen to have tumors that are intrinsically more sensitive to being responsive to therapy. I don't know. Well, there's a number of environmental causes linked to some specific cancers, but let's focus on glioblastoma or GBM. For GBM, or for gliomas in general, the only known environmental factor is exposure to ionizing radiation, whether that be radiation you got as a child for leukemia or in a real abomination back in the 40s or 50s, children with tinea capitis or cradle cap got treated with electron beam radiotherapy and came down with brain tumors. That was just a terrible tragedy. Or you just happened to buy a terrific condo in Chernobyl or Fukushima a week before something catastrophic went off and you stayed there. I mean, I think those are the kind of things. We know radiation causes glioma. We are unaware of any other environmental exposure that has been proven to be a cause of glioblastoma. Yes, we are running a trial, we've been running it for a long time now, of a modified poliovirus. We have finished a phase 1 trial of 61 patients we've submitted for publication. And what we've seen is in recurrent GBM, which is the population excuse me, we're talking about, we've seen that about 20% are surviving 3 years plus, which is reasonably extraordinary considering that the average or the median survival after recurrence of a GBM is 8 months. We've got several patients out over 6 years. The new study is a 4-institution study that will include a site in Florida. Boca Raton Regional Hospital will be one of the 4 sites. And basically that is a randomized study between the modified poliovirus or the virus coupled with 1 dose of CCNU. We've got a trial for children. We've got other trials that are coming. We're going to be treating patients with melanoma, patients with breast cancer. The receptor for this modified poliovirus is on virtually every single cancer, solid tumor, except for Burkitt's lymphoma. So it's very exciting work. But again, it's too early to say that we should be patting ourselves on the back.
Right. So it takes a long time, I'm sure, to get everything you need.
Absolutely.
So you can
certainly seems like a higher number than one would expect in that common time frame in such a small denominator as the size of that town. However, it's very difficult to prove that there is a causal relationship that affects all of them. So when we're told about something like that, the thing that we always suggest to people is to contact the CDC in Atlanta and to say that you are worried about a potential cancer cluster. And then they will do the investigative look to see if there really is something that might tie it all together. But it's very difficult to do that.
And you said it's a very long process.
It is a long process. It takes a lot of work. Again, etiology of it would have to be something that goes back a long time, because typically if you're exposed to radiation, it doesn't happen in a day or a week or a month. We're talking about multiple years or decades, decade at least, for something like that to manifest itself. So I'm not telling anybody that they should be concerned, but I think that it does bear some investigation. You don't know what predispositions any individual person may have to getting a cancer. Nothing is going to be that dramatic where everybody's going to get it. Nothing has ever been shown to be a waterborne or airborne type of environmental etiology for this. It's truly exposure to ionizing radiation. Now, could there be that the town is sitting on an old uranium mine or a waste site for a radioactive substance? That would be disheartening, and that certainly could be an issue, especially if these are people who've lived there for a long time. But short of that, it's hard for me to think of a true biological explanation that could give you a reason why 10 or 11 people in that small town have glioblastoma. I don't know.
They've got fertilizer plants, a power plant, and a landfill all in their town. So
it would depend on what, the first thing I would probably do is I'd get somebody with a Geiger counter and just go there and see if there's a source of radiation. If there's a source of radiation, then the question is, how long has that been going on? Because we know radiation is a source. But when people talk about other things like vinyl chloride or other potential toxins, nothing has ever been demonstrated to be an etiologic agent. I think it would be quite interesting if we found out that, again, there is a prodigious source of radiation from a landfill there. That would raise a lot of concerns.
absolutely.
I think that there are studies that show that in adults, as they age, there seems to be an increasing incidence. I think in children, it's not as clear. I don't think anybody knows for sure if there's an increasing incidence or not, but as people live longer from other sources of quality medical care, I think the period at risk is greater. So that could certainly be a factor that's at play. But I can't say for sure that there's an absolute increase in the numbers, although I think there are people who believe that and have written about that. One thing to remember is, as high visibility people like Senator Edward Kennedy, Senator John McCain, get these tumors, the public, because they get so much exposure from the media, the public begins to pay attention to that. And I think that there may be better reporting, a more accurate reporting of the numbers, just because people are paying more attention to the disease process.
Diseases.
Well, I think that there are certain organizations out there that are support groups, whether it be the American Brain Tumor Association, the Brain Tumor Foundation, Brain Tumor Network, and Brain Cancer, that can help people without violating HIPAA to see if there are other people in their community who may well have it. The incidence numbers are not difficult to get, but to get specific names, you're right, HIPAA is a roadblock, and then there are people who don't want to discuss it. There is still a stigma some people have towards the diagnosis of cancer, but many programs have support groups, and those support groups can lend themselves to an interchange between people who suffer from a brain tumor, and then they're not usually GBM specific, but you can at least begin to see if there are others in your community who have it. But it is not a simple reach. You're absolutely correct.
Normal, or is that something else that kind of raises a red flag?
It actually speaks against a common environmental source, because typically for ionizing radiation, this is a many year process, not a short process. So at first blush, it doesn't seem like there's going to be a common environmental etiology for what these patients have gone through getting the GBM. But medical investigation as done by CDC is really a very sophisticated way to look at the problem. I would definitely make sure that somebody notifies the CDC.
Gotcha. Have you ever been involved with cancer cluster? I mean, have you ever had to lend your expertise to any kind of research like that?
I've certainly been notified about other clusters, apparent clusters I should say, but I don't really have that in my area of expertise to do the research for that. I'm far more focused on the identification and the treatment of these patients.